Welcome to your 2015 City of Knoxville Benefits Enrollment. Today we will talk about changes for 2015 as well as how to enroll in benefits. We'll keep this brief, but you can call Employee Benefits if you need help. This is David Brace, the city's Director of Public Service. David believes folks should go home from work healthier than when they came in, and we couldn't agree more. Let's start by reviewing changes to your benefits for the upcoming year. First, let's talk about changes to our medical plan. Beginning January 1, 2015, Summit Medical Group will be in Network S. That means we will no longer offer a network that doesn't include Summit. Additionally, as part of the Affordable Care Act, prescription drug copays will count toward the out-of-pocket maximum for all plans. And because of that, we will need to raise the maximum out-of-pocket on our plans to $2,500 for an individual and $5,000 for family. While our copays for the city's RX plans won't change, our vendor may. The city is in the process of finalizing a contract. Once approved, we will broadcast this information as soon as it's available. If you have any existing prescriptions, you may want to get them filled before the year ends rather than waiting until the last minute. Now that we've discussed the upcoming changes, let's talk about our medical plans. Not much has changed with choosing your plan. First, you select your network, either Network S or Network P, keeping in mind the big difference now is that Tenova hospitals are still not in Network S. Next, you select which deductible is right for you and your family, $500 or $1,000. Finally, you need to decide whether you want to participate in the My Health Wellness Rewards program or not. Here's a chart with the basics of our plans side by side. Notice that both plans still have the same out-of-pocket maximums. Here are the rates for 2015. With Summit Medical Group now in both networks, a rate increase for Network S was necessary. The rates for Network P are decreasing from what you're currently paying. It's important to remember that if you've elected to participate in My Health $1,000 Network S plan, employee-only coverage with the HRA money, the city is still paying you to take our coverage. Now let's talk about My Health, the city's wellness program. Your coworkers are taking full advantage of My Health and reaping the rewards. They are losing weight. They are learning how to eat better. And they are motivated to continue on the path toward greatness. The rewards are plenty. Lower health premiums, free or reduced prescription copays for certain medications. For people who live with certain chronic conditions, free testing supplies, and HRA dollars from the city. Let's look at the HRA dollars more closely. As a My Health participant, you will earn HRA dollars, $32 a month for employee-only coverage, or $64 a month if you cover dependents. If you earn less than $44,300 a year, you will receive additional HRA dollars from the city. And if you or a covered dependent participates in the center's prenatal program, you can earn $200 in your HRA. You can use your HRA dollars to pay for qualified medical expenses, prescription drug copays, as well as dental and vision expenses incurred by you and your eligible dependents. This includes out-of-pocket expenses that count toward your annual deductible, copays, co-insurance, and other eligible expenses. Not all expenses are eligible, though. You can visit wageworks.com for a complete list of eligible expenses. This web address is listed in your 2015 Guide to Your Benefits. If you don't spend all your HRA dollars during the year, they roll over to the next and are available to you as long as you remain covered by a city-sponsored medical plan. This includes COBRA and retiree coverage. If you expect to have out-of-pocket expenses greater than the HRA dollars you'll receive from the city, you can contribute your own pre-tax money to the Healthcare FSA. Since anything greater than $500 left in your flexible spending account is forfeited at year-end, expenses are paid from your FSA account first. When your FSA funds are gone, expenses will then be paid from your HRA. To qualify for My Health Rewards, you must receive an annual health screening, be physically active and complete a monthly physical activity affidavit, complete quarterly health education, manage any chronic conditions by meeting with your health coach, including tobacco use, and seek an annual well care visit for your covered children. If you don't meet the requirements of the program, you will be removed from My Health and miss out on premium savings and much more. It's all about being active and aware and then recording the results. Look at the Mathises, a great example of carrying the My Health message home and getting the whole family involved. If you choose not to participate in My Health but still want city-sponsored medical and prescription drug coverage, you can enroll in the medical-only option. Medical and prescription drug benefits are available for medical-only participants, but you'll be paying more for coverage because you won't be receiving the My Health discount, and there are no built-in rewards such as HRA dollars and lower prescription drug copays. My Health. It's not a diet, it's a choice you make. If you don't plan to enroll for city medical coverage, you can provide proof of other coverage and the city will contribute $500 to a healthcare FSA in your name. You can then use those dollars to pay for eligible healthcare expenses incurred by you and your dependents during the year. Your prescription drug coverage is part of your medical plan and is offered through a different vendor than BCBST, so you have a separate ID card. More information will be forthcoming about the city's pharmacy vendor for 2015. Here are the copays for prescription drugs. Remember, if you choose My Health, you'll not only receive discounted prescription drug copays for medications used to treat chronic conditions, but you will also pay lower copays for non-preventive brand medications as well. It's important to know if requesting a brand name drug when a generic equivalent is available, you will pay the generic copay plus the cost difference between the brand and the generic drug. Now let's turn our attention to the center. Most of you are already familiar with the city's Health, Education, and Wellness Center, also known as the Center. If you're enrolled in My Health, you've probably come to know the center pretty well. You don't have to be enrolled in My Health to use center services. All city employees can use the center, but My Health employees receive services for a lower copay. In addition to health education classes and health coaching for My Health, the center also provides treatment for short-term illnesses for a small copay. You and your covered dependents ages 13 and older can take advantage of these services and pay with cash, check, a debit or credit card, or even your FSA and HRA card. One other important note about the center. The current facility will be torn down in the process of building the new Public Works complex, so we will be located in temporary space until the project is complete. Stay tuned for more information. Although I've spent most of our time talking about your medical options, there's much more to your city benefits, including dental, vision, flexible spending accounts, life insurance, and voluntary products. You can read more about each of these benefit plans online at cityofknoxville.org/benefits. Your 2015 Guide to Your Benefits provides descriptions of each plan. But let's take a quick look at these other benefits. Dental. First, the city provides a free base dental exam to all benefit-eligible employees, even if you waive coverage. That includes an annual exam, a cleaning, and a set of bite wing x-rays for you. Your spouse and children are not eligible for this base plan. The city also offers buy-up dental options, a low and high option with Delta Dental, and a DHMO option through Cigna. Take a look at this chart and let me walk you through the differences. The city's Delta plans give you the freedom to see a wide range of providers, and you can choose a plan with or without orthodontia. With these plans, you pay a percentage of the cost. The Cigna DHMO offers copays for services in their patient charge schedule, but the network of available dentists is small. There are no waiting periods on any of these plans, and you can elect a different plan every year as your needs change. If you need help deciding what option is right for you, just ask. If you choose to enroll in the dental plans, there are no changes in rates or plan design for 2015. Make sure you verify your dentist is in-network before selecting a new plan. The city also provides all benefits-eligible employees with an annual eye exam for a $10 copay if you use an iMed provider in the Select network, as well as discounts on products. You don't have to be enrolled in the vision plan to receive this benefit. You can purchase additional vision coverage for yourself and your eligible family members, which covers exams, lenses, frames, and contacts. If you choose to enroll in vision, there will be no changes in rates or plan design for 2015. There are no changes to the rules of the FSA, but it is important to note that if you want to participate in one or both of the city's flexible spending accounts, you must re-enroll each year. Your 2014 FSA participation does not automatically carry over. The maximum you can contribute is $2,500 to your healthcare FSA and $5,000 to your dependent care FSA. And remember, the IRS will allow you to roll over up to $500 into the next plan year. Should you elect to enroll in FSA for 2015, you cannot use your FSA card in 2015 to pay for a 2014 expense. Finally, a very important reminder, FSA and HRA dollars can only be used for eligible tax dependents. For more information on eligible expenses, review the 2015 Guide to Your Benefits or visit wageworks.com. As a reminder, the city provides basic life coverage equal to $50,000 at no cost to you. You can purchase supplemental coverage for yourself, your spouse, and/or your dependent children. If you are already enrolled in supplemental life, each year at annual enrollment, you can increase your supplemental life coverage by $10,000 or $20,000 for a maximum coverage amount of $100,000 with no medical questions asked. If you make any other changes to you or your spouse's coverage, you must complete an online evidence of insurability for approval by the insurance carrier before your coverage increase can go into effect. If you've never enrolled in supplemental life before, then the same rules regarding evidence of insurability apply. More information on the city's life insurance is in the 2015 Guide to Your Benefits. You can only enroll in Vacation Cell, formerly Benefit Bucks, at annual enrollment, and you'll need to re-enroll every year. Your 2014 election does not carry over. Remember, you can sell up to half of the leave you'd accrue in the year. You can also enroll in the Sick Leave Bank at annual enrollment. This is the only line of coverage that will require a paper form. See Employee Benefits if you'd like to enroll. Remember, if you have enrolled in the past, you do not need to re-enroll. The city makes several voluntary plans available to employees: short-term disability, lifetime benefit term insurance, cancer insurance, critical illness insurance, and accident insurance. If you are interested in adding or dropping coverage, you can do so online or through the Benesync call center during the last 2 weeks of January. The numbers and website are located in the 2015 Guide to Your Benefits. Now that we've reviewed upcoming changes to your benefits and given you a more in-depth look at the plans available to you, it's time to enroll. You have until November 30th to make your 2015 benefit elections. Enrolling is easy. Just go to Inside Knoxville and choose Online Annual Enrollment 2015 from the citywide drop-down box to get started. If you don't go online to enroll before November 30th, your 2014 benefits will continue in 2015 except FSA and Vacation Cell, formerly Benefit Bucks. You must re-enroll to continue these plans. Once your benefits for 2015 become effective on January 1st, you generally can't change them during the year unless you experience a life event, such as getting married or having a baby. Once you experience a life event, you have 60 days from the date of the event to notify Employee Benefits. Life events that allow you to change your benefits mid-year are listed in your 2015 Guide to Your Benefits. Everything we've talked about is here in your 2015 Guide to Your Benefits. And as always, the guide is available online at cityofknoxville.org/benefits or on the employee benefits page on the intranet, along with more detailed plan information. Remember, if you have any questions along the way, Employee Benefits is here to help.